So patients with a personal or family history of medullary thyroid cancer, patients with a personal history of multiple endocrine neoplasia type 2, a patient who is pregnant or considering becoming pregnant, patient who may have a hypersensitivity or insensitivity allergy to medications in the same class of medication, to semaglutide. If a patient does have some sort of complication and we deem it's best by communication with the patient, kind of weighing risks versus benefits, and determine that it's best to titrate off the medication, there are reasons to still continue coming here to Plaza Aesthetics and Wellness. We will continue to manage the patient from a behavioral modification standpoint and also consider other medications that assist with weight loss. So just because they may not be able to take semaglutide, that doesn't mean that we aren't able to assist them with long-term weight management. So there isn't a one-to-one substitution. There are other glucagon-like peptide receptor agonists. One is also trizepatide, but they are still in the same family. So if one fails one, likely they would fail the other. We wouldn't equal substitution. There are several other medications that may be in a stimulant class or kind of in an antidepressant family or in an addiction family of medications that may work really well for patients that are requiring medical weight loss. This is one of the reasons that we screen patients before they come in for their initial consultation. If we have a patient that is just kind of learning about the medication and has a few questions, it's really appropriate for us to consider a phone consultation where we are able to see what their weight, body mass index is that's based off of their weight and their height, and determine if they're an appropriate candidate for this medication. And then if they do pass that pre-screening, then it's appropriate for them to come in for that initial consultation and see myself. This is absolutely not a quick fix. This is not for the patient who would like to lose 5 or 10 pounds or just to get jump started on, their weight loss goals. This is long-term overweight and obesity management. This is not for a patient who is either starting off as thin and just has a few pounds of weight to lose, or someone who just wants to trial the medication for a few doses. This likely may be a medication that the patient is requiring lifelong.